Hi there. With this session, we're going to discuss how insurance for health became linked with employment in the United States. And this is part 4. So learning objectives for this video and session and to discuss thereafter will be to appreciate why the United States linked health insurance with employment and what the factors were during World War II that created that occurrence. To understand those economic forces, the nature of labor unions and politics, and how all of that contributed to creating the tax structures that consolidated employer and sponsored insurance in the post-war years. And we'll just begin to discuss the developing fight for Medicare. So, wartime, Pearl Harbor. We know that some companies did create healthcare coverage prior to World War II, but that linkage was far from being common or fixed prior to 1942. We have ships sinking in the Pacific, a nation under war. We have a huge federal spending process with money being pumped up to produce tanks and jeeps and airplanes and ammunition and the like. And the government is printing money like it's going out of style and pumping it into industry. There are fewer workers to work in those industries due to the mass enlistment of soldiers. So it's a relatively small workforce. And that workforce is well paid. Every industry wants to attract the best workers to their lines. Those workers who are being well paid are finding that they cannot find a lot of goods to purchase due to restrictions and scarcity during wartime. So Rosie the Riveter is at the job and drawing little lines up the back of her calf instead of purchasing nylons due to the products being sent to the wartime effort. Well, the government and economists had seen the decimation of post-Germany's economy due to serious inflation. And they had recognized that these were hallmarks of hyperinflation. So to fund the war and soak up the unspent salary, new taxes were created on the middle class. This is the first time middle class experienced federal taxes, which were automatically deducted from their payroll. Here's some more folks on the assembly lines. Another option was creating war bonds, which were promoted to divert folks' excess salary into future savings. However, all these efforts were felt to be insufficient. Hence, the Wage Stabilization Act. These ongoing inflation fears resulted in Congress passing an act which today seems socialist and remarkable, that a society would actually fix wages for various industries. But this was a true emergency rather than a false emergency and was a necessity. Work benefits, however, outside of one's salary, were not fixed. So folks came up with the idea of providing health care as a benefit. Contributions by the employer for a worker's health care was deemed to be tax deductible. So companies, in competing for workers, offered health insurance as a popular competitive perk. Unions, which were powerful at the time, certainly accepted this benefit as in lieu of a salary increase, which was not feasible. And ultimately, inflation during the war years was controlled. However, as the war ended, we had 10 million soldiers returning home to enter the economy, and the emergency wartime wage and price controls were abandoned. Inflation, as a consequence, rebounded for these same reasons. Relative shortages, increased income, and labor was now demanding new contracts, and employers lost tax deduction of those contributions for the health benefits with the end of the war. Workers were convulsing the nation with strikes due to lack of adequate reimbursement and power. During this time, as an alternative to employee-linked insurance, Truman proposed with his Fair Deal a government-funded health insurance. This health insurance would pay for medical costs, hospitalization, and dental care. It would be funded via a 3% payroll tax, and it would essentially cover 80% of Americans, or 110 million people. All eligible persons would be required to enroll. That's a mandatory enrollment. But the nation had been working hand in hand as a community to accomplish the New Deal and many other benefits, social benefits, that did require modest taxes. So this was not entirely out of keeping with what had transpired during the Great Depression and the war. This health insurance program, by the way, would not fund hospitals. It would not pay physician salaries. It would not basically interfere with the relative independence of both hospitals and physicians. And that's unlike what we see in socialized medical programs elsewhere. In any case, during these years, a Gallup poll found that 60% of Americans were in favor of his proposal. The other thing that was happening after the war was a serious shortage of hospital beds. There were few hospitals built during the Depression due to folks wanting not to or unable to fill those beds due to poverty and the restrictions during World War II. So in order to help states suddenly create and build new hospitals, the Hill-Burton Act was passed by Congress. And this would provide federal grants to the states to construct hospitals. Southern Democrats in this Democratic-led Congress during these years were opposed to any desegregation. So, unlike any other laws passed in American history, the Hill-Burton Act had a clause that the government-funded hospitals would be separate based on race, but supposedly equal. Meanwhile, of course, during this era, after the war, Britain enacted an expansion of its national health services, and this indeed was a true socialized model in which the government directly funded the construction and payment of hospitals and the payment and salarying of physicians and nurses and staff. Again, we'll see how that expanded elsewhere in other European nations. Well, we had seen employee-sponsored insurance working for industry during the war, and the tide was turning during a Red Scare, where Congress was now becoming more conservative, and the National Health Insurance, sponsored and promoted by Truman, was vigorously opposed by the Chamber of Commerce, the American Hospital Association, and the AMA, as we are not surprised. It was labeled socialism once again, and even though its mechanisms were different. And unions remained split in terms of supporting it, as again, their main accomplishment during the war was to provide health insurance via the employer, and this is what gained union status and power. So here's just a image of socialized medicine. Again, there were crippling national strikes in the late 1940s. And in a response to these crippling strikes, Taft-Hartley Act, a conservative law, was passed, which limited the powers of unions to various certain selective issues under collective bargaining law. However, the following year, the Supreme Court ruled that employee health benefits are a legitimate issue for union management negotiations. In the meantime, the Southern Democrats actually blocked and defeated ultimately the Fair Deal of Truman, partly in fear that federal coverage of health actually might result in outlawing segregation. Thereafter, a few years later, Congress made the health coverage a non-taxable benefit for workers, and essentially making employee-sponsored insurance equivalent to a raise in salary. So all these legal measures was consolidating employee-sponsored insurance in the lives of working Americans, at least some working Americans, as we'll see. In this post-war years, industry grew rapidly. There was huge economic growth and large industry, including U.S. Steel, GM, AT&T, General Dynamics. A variety of different industries were employing huge numbers of workers, and they favored, as did union employee-sponsored insurance. During this era, taxes were remarkably high by current standards. People do not realize that to pay for the war effort and the deficit that existed, taxes were 90% on the wealthy. And ultimately, as the 50s entered a booming economy, there was actual deficit, actual surplus, federal surplus. 75% of working adults received health insurance through their employer. And the majority, by the way, were receiving their health insurance through nonprofit Blue Cross and Blue Shield. And their premiums were based on community rating. With that surplus during the post-war years, veterans were provided the GI Bill, as well as the Veterans Administration hospitals were developed. Indian Health Service was first formed, and never well funded, but it was formed. And the role of physicians in society was respected and felt to garner authority. Television, which became popular and available during the 1950s, ultimately had paradigms of healthcare such as Dr. Kildare or the surgeon Ben Casey. So it was an interesting time in America. Third-party relationships were basically the foundation for patient-employer insurance. The third party, that is the insurer, set the price for a package for a union or an employer to offer to its workers. That price was determined by the size of the number of workers, the size of the pool, and the general state of the members of that pool. And so each employer would negotiate an agreement with the insurer, and then the employer could offer that benefit to enrollees. That's not that dissimilar from what we see in the modern age. And the employer could choose among plans and decide what percentage, if any, the employee would have to share for the provision of their health insurance. However, many people were not employed by large legacy corporations. And this is where we learn about the other America and where folks fell between the cracks. John Kenneth Galbraith was a well-recognized economist who wrote a book called The Affluent Society in 1958. And he highlighted an unprecedented economic prosperity, but also underlined widening income disparities and an illusion of actual societal prosperity where societal public services were neglected. He wrote a lot about consumerism and the advertising that led to consumerism and the ever greater appetite for new and new goods that the economy depended on. In this same age, however, there are multiple Americans who had low-wage jobs, who could not have a benefit of an employee-sponsored health insurance, and many living in poverty. They were called the socially invisible and accounted for probably 40 to 50 million Americans. There are few affordable health insurance options for those folks. and here's some people lining up to try to get jobs at a auto manufacturer. And racism, segregation, again, continued to be sponsored by the American Medical Association, unfortunately. The National Medical Association, which you may remember was a black association for physicians, for African American physicians, tried to, again, after the war, be allowed associate membership. Remember, many black Americans were serving in the armed forces, but that proposal was rejected by the AMA. 1946, we talked about the Hill-Burton Act, which was an initiative for constructing healthcare facilities. Congress codified that funding as being separate but equal. That was in 1963 that element of segregation of the Hill-Burton Act was overturned in federal court. That's 9 years after Brown versus the Board of Education, where desegregation of schools was felt to be illegal and unconstitutional. Ultimately, the AMA's role here was to urge Congress to amend the Hill-Burton Act such that participation of a private hospital in the Hill-Burton program does not in any way change the private character, quote unquote, of the hospital, other than outlawing racial discrimination. This was an era where first the society was looking at civil rights, and in 1964 the Civil Rights Act was actually passed, making it illegal for any federally funded program to discriminate based on race, color, or national origin. What a wildly different time than we are living in currently in terms of federal actions. Anyhow, equally important during this era was the folks who fell between the cracks due to age. So in 1964, life expectancy for men was about 67 years, and that for women about 74 years. Seniors, not surprisingly, incurred twice the amount of hospital care than those folks who are less than 65 years of age. And as many as 50% of both seniors and the disabled went without health insurance. The reason is they were considered bad risk by commercial insurers. Blue Cross Blue Shield was not available to them. The other private insurers, indemnity insurers, did not have any interest in losing money on their health needs. So, and as many as 25% of seniors went without any health care whatsoever, simply due to cost. During this time, those seniors' kids had health care. And United Auto Workers and other unions supported actually the concept of Medicare for their parents. But at the same time, they didn't support universal national health insurance for their workers. So as we will see, there'll be some further discussion of Medicare in these years. Just briefly, in 1957, there were two Democratic senators, Forand and King, who offered a conception for a modest bill that would cover hospital care for the elderly using the pre-existing Social Security agency, which was funding well-accepted Social Security. It was not a universal insurance. But John F. Kennedy was elected in 1960, and he faced a less polarized electorate. That electorate had witnessed the benefits of safety nets created during the New Deal and the actions of government, and efficient government, to win a world war and help pull people's feet out of the fire during Great Depressions. This was a liberal Congress that was also brought in 1960, to an extent, a more liberal Congress than we see today. In 1960, there was a conservative bill from the Senate called the Kerr-Mills Act that passed both houses. This was an unambitious, limited means of covering the poor. It was income-based, a means-tested coverage for both poor as well as old citizens, but it was purely optional. and only 28 is optional because it was administered by state government, and only 28 states elected to sign on to this act, resulting in only 1% of America's elderly receiving any health benefits. Clearly, that was not going to be a solution, but the world changed in the U.S. in 1963 when JFK was assassinated. And here's a photo of Lyndon Johnson being sworn in with Jackie Kennedy at his side on the airplane coming out of Dallas. Essentially, 1965, after both houses of Congress were taken by Democrats, the stage was set for significant reform, and we'll learn a little bit about Medicare in our next session. See you then.